52% of parents have not firmly made up their mind about getting their child under 5 vaccinated. That's according to new Ad Council research. With summer activities underway and a new school year approaching, the Ad Council and COVID Collaborative are partnering to address questions and concerns parents might have about the vaccine. Dr. Savio Beers, professor of pediatrics and the medical director for community health and advocacy at Children's National Hospital, and she was the 2021 president of the American Academy of Pediatrics, joins us this morning. Thank you so much for being here with us.
Thank you so much for having me. It's my pleasure.
Now that these vaccines are available for kids 6 months and older, what can parents expect, and how do parents manage potential side effects?
Yeah, so, one of the things that parents can expect, first of all, we're so grateful actually that this safe and effective vaccine is available for our children ages 6 and up. And so what parents can expect is very similar to what we see in the older kids, adolescents and adults. The main side effects that families might see from the vaccine are, just like with all the other routine childhood vaccinations, sometimes a little bit of sore arm or leg, maybe a little bit, maybe a little feeling under the weather, a little not quite yourself, or a little bit of a low-grade fever. These things should, are typically very short-lived and very easy to manage at home.
What are some of the concerns that you may have seen from parents regarding this vaccine for their young children?
I think most of the times parents just want some good information. I think this is, I'm a parent too of 2 teenagers who did get their COVID vaccine as soon as it was available. And I think parents mostly just want to be able to ask questions and have their questions answered. I think one of the things that sometimes there's some misunderstanding about is how serious COVID can be in children. Thankfully, children generally are very healthy and most will do well with COVID, but many will not actually. We've seen, tens of thousands of children hospitalized. We've seen many with longer term effects and longer term aspects of the illness. And we know this is a safe and effective vaccine. And so it's a really important opportunity to help protect our kids against a potentially severe illness.
And Dr. Savio Beers, when a parent decides to get their child vaccinated, how can they best prepare that child?
I think this is something I talk to parents about all things related to going to the doctor. First is really just talking to them about how the doctor is a place where they go and we work together to keep everyone in the family safe and healthy. And I tell parents to be honest but reassuring. So, let them know you're going to be getting a shot and it's going to hurt for a second, but we're going to be right there with you. We're going to help make sure it's not going to last very long, and we're going to give you lots of hugs and love to get you through it. And it'll be over very soon. And it's a really important part of helping you stay healthy into your future.
And some of those kiddos might have questions for their parents. How do parents best go about answering those?
Yeah, so, parents, first of all, important for parents to make sure that they've done some good reading and they understand we've got 2 great websites, getvaccineanswers.org and healthychildren.org, which have lots of good information about the vaccine to help parents answer their questions. But also, if kids ask a question that parents don't quite know, then that's actually something that as pediatricians, those of us who are giving the vaccines, we're happy to talk to kids as well. This is what we do. We do this all the time. And so we really know that kids have lots of questions. Sometimes they're unexpected ones, often they're really good ones. But we're really happy to answer those.
Again, and finally, some parents might still have some questions that they want answered. Where can they go to get some more information, then also to schedule an appointment?
Yeah, so the first place I would call is your pediatrician's office. So, the much more of this vaccine has gone to pediatricians' offices, though we know it hasn't gotten everywhere yet. So, but the first place I would call is your pediatrician's office, because they'll be able to let you know if they have the vaccine, and if they don't, where you can find it in your community. And then also, if you have questions, you can talk to them about it, or again, you can go to those websites, getvaccineanswers.org or healthychildren.org. There's a ton of really, really good information there.
Some great resources available. Dr. Savio Beers, thanks for joining us this morning. We appreciate it.
Oh, very much my pleasure. Thank you for talking about this important topic.